If you're looking for evidence-based information on chlamydia treatment, chlamydia symptoms, then I'm going to give you all of that in this week's video. We're going to talk about chlamydia symptoms, we're going to talk about chlamydia treatment options, and how we get rid of it in practice. What we're waiting for. Hit that like button if you're fired up for this. Let's go. Okay, so let's begin with chlamydia symptoms. Here's the fact: 70% of women and 50% of men don't really have symptoms with chlamydia, which is why it's so important that you always get tested. However, if you were to have symptoms, the symptoms usually manifest within 1 to 3 weeks of exposure. Sometimes it can happen months later as well. Symptoms in women can include pain on urination, unusual vaginal discharge, pelvic discomfort, pain during intercourse, and irregular bleeding. In terms of symptoms for men, you can get discomfort or a burning sensation during urination. You can also get urethral itching, you can get testicular pain, you can also get abnormal discharge from your penis as well. Next up, let's move on to chlamydia in other locations, okay? Because chlamydia doesn't only affect your genital area. So for example, we can get something known as rectal chlamydia. Patients who have this might exhibit discomfort, pain, or even discharge from the rectum. Patients who get this is usually from unprotected anal intercourse. We can also get something known as throat chlamydia. In terms of symptoms, they are quite uncommon. Sometimes you can get a bit of sore throat or discomfort, and the way that you catch this is from unprotected oral sex. Now we can also get eye chlamydia, okay? The symptoms are similar to eye conjunctivitis. You can go pink, you can go red, you can go sore, and you might even get discharge. So the moral of the story is, if you suspect you might have chlamydia, or you're worried about it a little bit, get tested, okay? Prevent future complications, prevent spreading it to other people, and I will leave loads of information in the description below on where to get tested, who should get tested, and different situations where you should get tested as well. Now, if you are looking for more information or treatment options for a particular medical condition, then let me tell you about Dr. Fox, who are very good friends of the channel. Dr. Fox is an online doctor and pharmacy who are ready to help with over 30 different medical conditions, and I will leave a link to them in the description below for you to learn more about their services. Definitely do check them out. Dr. Fox, thank you for being our trusted sponsor. Thankfully, when it comes to testing for chlamydia, it is super simple. It's not painful at all, very easy. It can either be done via a swab test or a urine dip test, okay? Easy as that, and the results come back very quickly. Now, if you're wondering how to get rid of chlamydia, well, it all comes down to antibiotics. Let's say you had a positive test, your medical provider might prescribe you an antibiotic, like azithromycin or doxycycline. Then again, there are other treatments as well, so whichever they think is best. The most important thing is you speak to your medical provider about it. Now, my intention for this video was for it to be brief and summarised, all about chlamydia, the treatment options, the symptoms. However, I will leave loads more information in the description below, and also some really useful NHS links which go into loads more detail, and FAQs that are really helpful as well. So definitely do check them out.